Well, the mission of HomePorts is really, it follows the village model, which is a model that's developed over the last 25 years. It's basically the community takes care of its own. It's built on volunteerism and a social cohesive network. So we take care of the people of our community, especially, and it's focused on the older people that tend to want to live in their homes, but are a little bit isolated, have difficulty getting out and traveling. And so, one of our core services is driving. We have volunteers that will drive members to medical appointments, to the grocery store, to the library, whatever. But we're trying to enhance that with a little more social activities. We have monthly luncheons, book club that's really doing well, other things to keep people connected and avoid the isolation that can occur to elderly folks living in their homes.
Yeah, I was going to say, honestly, our mission really hasn't changed since we were founded in 2008. I guess we were incorporated in 2007. We're a 501c3. And services started being offered in 2008. And our mission really hasn't changed, as John says. It's about all the things that he mentioned. What we're seeing is, we actually talk about people 55 and over. And 55, 20 years ago, was a different sort of thing than 55 today. I think people are, the aging process is slowing and people are staying healthy and active and they want to remain independent. 55 isn't that old.
Now our volunteers tend to be 55 to 70, and the members tend to be over 70, and plenty of members in their 90s.
And also, one of the things that you did mention that I think we're seeing a really uptick in is friendly visits. So I may need a ride to a doctor's appointment or I want to go to the library, but also for some people, it's just about that one-on-one connection and having somebody just come by and have a cup of tea and, do some quilting or whatever it may be, read a book together. And so we're seeing really an uprise in that.
Or even just a telephone call, when we called about the monthly luncheons, people were glad to get a call. I think there's a number of challenges. I think the main thing for our mission is that we're not serving a lot of people that would benefit from our services. And why is that? We're a small organization. We have to build a reputation and build trust around that reputation. And we have to connect with the older folks that tend to be kind of isolated. And it's hard to connect with them. They're not on Facebook, in general. They might struggle with technology. So I feel like we have a lot easier time finding volunteers than we actually do finding the people to serve. And we want to match that growth. As we grow more members, we want more volunteers, so we have a match there. So that's, I think, our main struggle. The book club's very popular and well run by CB, and people just thrive on it. In fact, they're now planning a field trip to a museum in Cambridge. As the book club, they've been reading books about this history, and so they want to go on a field trip for it. So it's great. Mm-hmm. I think a lot of times that the children of these seniors are to some extent who we should be marketing the services to. But they don't live around here necessarily. Most times in our society, young people are living at a distance from their folks. And so they have a hard time taking care of themselves. So we fill in that gap. But to a large extent, if we could appeal to the children of those seniors, and they would say, yeah, that's a great service. I would like my parents to be more active, to be more engaged, and I would feel good about that. Well, one thing, Karen mentioned fundraising, and we have one activity coming up that's a fundraiser and an educational event, and it's been going on for a while, the Health and Wellness Expo, which is in October this year. It's going to be October 16th this year. Sponsored by the hospital and the health department, and a real partner in the YMCA because we hold it in the YMCA gym, and it brings in like 50 exhibitors, all kinds of organizations and nonprofits involved with health and health services and wellness, and then people, it's free, people can come and learn and discuss, and hopefully we make connections between these different groups, these exhibitors. There's specialists that come and speak on topics that are important. We haven't nailed all those down this year, but we'll have several speakers come and talk.
And that'll be October the...
16th, October 16th. It's a Thursday, 3 to 6 p.m.
Went back to the sort of how we get the word out and how people learn about us. The rest of the nonprofit community is one of our best avenues for that. So partnerships with Herb Kane over at Upper Shore Aging and Genevieve at Rebuilding Together, because again, in many ways we're all serving the same people, and so these venues, Amy Lynn Ferris, the center over there, has a lot of people coming in every week for programming and lunch, and so we're looking for ways to just continue to really build that network, so that the word gets out through our partners as well.
Yeah, definitely. There's a lot of room for collaboration. There's a lot of overlap in these nonprofits, how they work. So we want to be sharing our efforts.